Hello everyone. Today we have to discuss about the spinal manipulation techniques. So initially we have to start from the cervical spine. First have to traction the cervical by using my forearm. My hand will place the under the neck. Then I give the downward pressure. This is the gun hold position. I giving the downward pressure to the mandible. Then fix the joint. Then in my right hand I give the supination and pronation. In this condition, upper cervical deformities and the Texneck syndrome and the sternoclavicular muscle tightness, then anterior neck muscle tightness, forward neck posture, stupid posture. So these all are the conditions mostly involved in upper cervical region. I mean C1, C2, C3 and C4 at the level. So initially I will mobilize the C1 to C4 upper cervical region. So placing my hand in upper cervical region, then I will do for supination and pronation. I can place here forehead and also the mandible to fix the joint. This is the distraction technique. In case of patients will affect in extension, pain during extension, that means I will give the snag technique. Like I will palpate the C7 spine, then above the C5 spinous process, C4, C3, C2 and C1. So I will give small amplitude thrust over the C1 and C2, also C3. These mobilizations will promote the neck extension. I can use transverse process also like this. Relax. So in case patients complain with rotation, that means I can use the spinal thrust, high velocity thrust, like cervical extension. It's a combination of movement, cervical extension, side flexion and rotation. At the end of the movement, I will give the small thrust. This is entire cervical manipulation. Again I will repeat, little back. Okay. So I holding his help, cervical extension, side flexion, rotation. At the end of the restriction point, I will give the small thrust. I will repeat in opposite directions also. Cervical extension, side flexion, rotation. I apply this small thrust. So entire cervical spinal manipulation. Relax பண்ணுங்க. Then C1 C2 mobilization. I applying the pressure over mandible, then I will give downward pressure. This tilting movement will promote the cervical C1 C2 mobilization. Relax. This is the position. And this is the measurement. Okay, one arm length measurement. So I holding like this, then place under the head. Relax. Head should be extension. The belt under the occipital prominence. Then now I give the traction. Do you feel the traction? Have to instruct the patients. In case a patient's complaint any sharp pain or giddiness, means just raise with the right hand. It will be reduce the compression for the radioulnar joints. In this position, I place the belt under the occipital prominence. Then neck should be extension. Then I apply the traction using my own body weight. It's okay, relax. I using also side flexion. Sorry. Now you have to go for thoracic spine. During thoracic spine, initially I will palpate the spinous process, entire spinous process one by one. Any muscle spasm or paras muscles tightness mean spinous process will be moved like this. So initially have to palpate that, and also some point will be tender. I will ask the patient about the pain history. So initially I will relax the paraspinal muscles. During thoracic mobilization, we use for three methods. One is V hand method, another one is hook method, and using for sitting position. Third one is sitting position. So first one I using for V hand method. My hand should be placed in V. Then I will give the pressure over downward and upward pressure. At the end of the restriction, I will do thrust. Take a deep breath. End of the expressions, I will give the some thrust. Relax. Okay. After this one, I using cross arm method. So cross arm method use it for 2 or 3 spinous process tightness or change in position. Using my thenar, placing one below the transverse process, another one is above the transverse process. I give two opposite directional force like this. Then I will maintain the traction force. Then I apply for thrust. I holding spine. Okay. I will give the neck extension. In this position, I give the thrust. Again, I will repeat. In this position, patient should be inspiration and expiration. During expiration, end of the expiration, I give one thrust. Now you go for lumbar region. Lumbar region also we give the downward pressure, PA glide, downward pressure at the 25-degree angle, like this. Okay. Lumbar rotation. Relax. கையை சைடில் வச்சுக்கோங்க. சரி, ஓகே, இதில் கம்ஃபர்டபுளாக வச்சுக்கோங்க. During lumbar rotation, I fix the upper extremities. Then I fix the upper extremities, and also I palpate the spinous process of the lumbar vertebrae. Then I give so small thrust. This is for lumbar rotation. So now you go for lumbar rotation. Any kind of lumbar rotation restriction patients, like during rotations pain will be aggravated or restrictions will be we have to reduce the zygofacial joint adhesions like this. Okay. I have to give the one thrust over here. Okay, this is a lumbar rotation. It will promote the right side rotation. Okay, now opposite eye. Now we go for sacroiliac joint. So sacroiliac joint is a immobilized joint. I have to pressure applied over both anterior superior iliac spine. I holding like this. Then I give the downward pressure. Sacroiliac joint mobilization, and also I give compression force. Holding like this, I give compression force. Now downward pressure and also compression force. Now we go for sacral mobilization. So using my hand like this, placing the hand over the sacrum, I give downward pressure. It will promote the lumbar extension. Now I will check the lumbar mobilization. See, lumbar stiffness is there. Both calcaneum will be not in same. That means one side of the lumbar stiffness will be present, and also hamstring muscles and glute muscle tightness will be there. Pelvic hike also is there. So during this condition, supine. During this misalignment, I using like this. Relax பண்ணிக்கோங்க, body full relax பண்ணிக்கோங்க. Take a deep breath and breathe out. Yes, again take a deep breath and slowly breathe out. Okay, during this time I using little abduction, hook position. This is called as hook position. So holding his ankle at hook position, I will give mild traction, then I will give sudden thrust. Relax. Okay, so I can use assistant to fix the upper body, or using Mulligan belt to fix the upper body also. Again I will repeat, little abduction, konjam the side vaanga. Okay, little abduction, hip should be extension. Now I give traction force. Along with, at the end of the range, I will give the thrust. It will be reduce the spinal compressions. The spinal manipulations graded. So this is the restriction level. Patients complain over the pain here. This is a normal range, I mean pain-free range. This is anatomical barrier. These red line 2 are anatomical barrier. So first one, grade 1. Grade 1 is a small amplitude. I applied for 1 or 2 counts per second like this. This is a grade 1 using the pain-free range, small amplitude. Grade 2, up to the midline to restrictions area. This is a grade 2. This is a large amplitude. Grade 3, from the midline to restrictions, over the restrictions area. This is a grade 3. It's also large amplitude. Now grade 4. Grade 4 start from the restriction level like this. I give small amplitude only. Now grade 5. Grade 5 will go for beyond the tightness level and I give thrust. So grade 5. Next we go for the temporomandibular joint mobilization. So this is a temporomandibular joint. This is a mandible. It's a temporal bone. In temporomandibular joint we have here protraction. This is the protractions movement. This is a retraction movement. This is the elevation movement. This is the depression movement. Okay, again I will repeat, this is the protraction, forward movement, this is the retractions, opposite movement, this is the elevations, this is the depressions, and also lateral deviations. Okay, these are the movements present over the temporomandibular joint. Now I will demonstrate the model. In temporomandibular joint dysfunctions or forward neck posture, and also any tooth implants or or stiffness over the temporomandibular joints. Joint atrophy means have to give the mobilization here. So during these manipulations, I will open the mouth, place my hand over the mandible, then I will give downward thrust. I can apply for grade 1 to grade 5 also. This is the one side. I can use for both hand, both side. Then I use for traction force like this. It will promote the protractions and retractions. Then I give the compression force like this. Okay, I applied for lateral force over here like this. Next we go for a model demonstration. Okay, my non-dominant hand places the under the neck, relax. Okay, my dominant hand places open like this, relax only. Okay, now give downward pressure. Temporomandibular joint dysfunctions conditions, other muscle tightness or mastications problem. During mastications, patients complain with pain means this will be supportive. I can use for opposite side also. Applying downward pressure. Now retraction force. I using 2 finger like this. Stabilize the skull, then distract the mandible by pulling the mandible. Okay, now compression force using, this is a gun hold position. Then I give opponent force. Open your mouth. Open. Okay. Open, yes. Open, yes. Close, relax. Open, yes. And the nut turn sound வருது பாத்தீங்களா, இதான் manipulation. Open, yes. Okay, I will give the downward pressure and instruct to open the mouth. It will be assist the retractions of the movement. Okay, now lateral deviations. So I am placing opposite side, open, you give like this. Same, open. Lateral deviation. Okay, mandible lateral deviations. Patients complain with during deviations mean I will assist the deviations movement by using these manipulations. Let's we come on the end of the sessions. Today we are discussed about cervical manipulations, thoracic lumbar manipulations, and also sacroiliac joint manipulations, and finally we are discussed temporomandibular joint manipulations. Thank you.